MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
Good morning, Professor Libby. Thank you very much for joining us today.
It's a pleasure to be here with you in Orlando.
As a vascular biologist, could you comment on the very interesting data that Professor Glynn presented yesterday from the JUPITER trial as regards to venous thromboembolism?
Yes, actually, from the perspective of vascular biology, the results are clinical validation of a lot of data about pleiotropic effects or non-LDL lowering effects of the statins. You know, there's not a very good relationship between LDL levels and venous thromboembolism epidemiologically, and the question is, how is the treatment with a statin producing this remarkable decrease in both provoked and unprovoked venous thromboembolism, as was just described by Dr. Glynn? Well, we believe that the statins have direct effects on the endothelial cell that is the critical interface of the blood with its coagulation components and the rest of the body. The endothelium possesses a number of remarkable mechanisms that maintain blood in a liquid state during prolonged contact. And those include mechanisms that are anticoagulant in the normal healthy endothelium, and also mechanisms that promote fibrinolysis, endogenous clot busting, so that if there were to be a stray little clot that would form, it would be chewed up immediately by the body's own defense mechanism. However, when the endothelial cell receives danger signals such as pro-inflammatory cytokines in individuals who have a high burden of inflammation, it changes the face of the endothelium from one that is compatible with blood, that combats coagulation and that promotes a fibrinolysis, to the opposite. The endothelium can change its character and actually promote clot formation and stability by inhibition of fibrinolysis. Now, it turns out that the statins can augment a number of the anticoagulant functions and actually ramp down some of the fibrinolytic inhibitors that are made by the endothelium, such as plasminogen activator inhibitor.
So it looks like the JUPITER study will help guide any impact this will have in clinical practice?
I think that this really expands the aperture of our appreciation of the vascular protective effect of the statins. And we've thought primarily on the arterial side, but now we have very good evidence to think that there may be vascular benefits on the venous side as well.
Thank you.